Our next presentation is the impacts of COVID-19 on high quality, high volume spay-neuter surgery. We have Dr. Simone Garrios. Dr. Garrios is a clinical assistant professor of shelter medicine and coordinator of the shelter medicine practice elective at the University of Florida. This course is a full-time 2-week clinical rotation at the Alucia, sorry, edit that one out, Kristen, County Animal Services. In her position, she focuses on training and educating students to make veterinarians ready for shelter practice. Her clinical interests include surgical diseases commonly found in animal shelters and high volume spay-neuter techniques. Prior to accepting a faculty position at the University of Florida, she worked as a clinical associate professor at soft tissue surgery and surgical oncology at Federal University of Paraná, Brazil. She started working with shelter medicine in Brazil, where she co-founded a spay-neuter program for local low-income community. This outreach program also provided community education, including public health, zoonosis, and animal welfare. And then we have a surprise guest joining us today during this session, which is Dr. Julie Levy. She is the Fran Marino Distinguished Professor of Shelter Medicine Education at the University of Florida, where she focuses on the health and welfare of animals in shelters, feline infectious diseases, and humane alternatives for cat population control. She founded Operation Catnip, a nonprofit university-based community cat trap neuter return program that has spayed and neutered and vaccinated more than 70,000 cats in Gainesville since 1998. In 2008, she joined Dr. Cindy Crawford to found Maddie's Shelter Medicine Program at the College of Veterinary Medicine in Educational and Discovery Initiative, with a global impact on the care of homeless animals. In 2014, she joined Dr. Kate Hurley to launch the Million Cat Challenge, a shelter-based campaign that saved more than 3.5 million cats in shelters across North America. In 2022, she helped launch Maddie's Million Pet Challenge to create transformative communities of practice that deliver access to care through humane, community-centric programming inside and outside of the shelter to achieve the right outcome for every pet.
Thank you. So good morning, everyone. I am Dr. Garrios, and we are actually very excited about presenting our research about the impact of COVID-19 on spay-neuter surgeries here to the United Spay Alliance online conference. So the big question for this research is how has the pandemic impacted the spay-neuter surgery or the spay-neuter community? And we all remember, and I think we all know and feel that the surgery numbers went down. So we remember that COVID in 2000 and by the end of 2008, the end of 2019, it started. We start talking about in beginning of January, it starts spreading towards one country to another, reached the United States. By March and April, lockdown started, and spay-neuter procedures were considered a non-essential surgery, so clinics stopped performing the surgery. And now we need our first question.
Yep, all right, I'm on it. I love my polls. I'm on it. So it's a two-parter. So the first one is, what role does your organization play in spay-neuter as a provider? Do you perform spay-neuter for the public? And you can check as many as you like on this. Or do you spay-neuter animals only in a shelter? Or do you do TNR surgery for community cats? So this one is 76% provide spay-neuter services for the public, 24% do it only for their own shelter. And they 82% perform surgery for community cats. So there is that one. Then I'm going to go to the next one. And this is as a paying client. And correct me if I'm wrong, Dr. Garrios. So what role does your organization play in spay-neuter? This is if you are a client. And then you use the spay-neuter clinics for animals in your shelter rescue. We use the clinics, spay-neuter clinics for TNR. We use we primarily use private veterinary clinics. So we have 36% use spay-neuter clinics for their shelter, their rescue. 73% use spay-neuter clinics for their TNR program. And then 36% primarily use private veterinarians.
So we always felt, and we still know, we really feel that we are back in surgery numbers, and we couldn't really catch up with this. Let me take you. We cannot really. We cannot really catch up with surgery. We don't have all of these animals that we stopped doing surgery. What's going on? So then so then we really need to do this study to be sure and to actually read and see the numbers and what actually happened during the pandemic. So for this study, we use a software, Clinic HQ. This is a cloud-based software used for specialized in clinics that do high-volume spay-neuter surgery and also wellness clinic. 400 clinics use the program in the United States, and it's estimated that this will represent around 13% of the clinics in the United States that perform high-volume surgery. And we analyzed the 3 years, so from January to December 2019, that was considered a normal year, so there will be our baseline. And then 2020 and 2021, we still considering as a COVID year. So from this 400 clinics, we were able to use 212 clinics that consistently gave us the numbers for the whole study, 3 years for the whole study. And this represents 42 United States and 201 cities in the United States. And this is what we saw. So this first graphic is showing this surgery, spay-neuter surgeries performed on the y-axis and by month on the x-axis here. 2019 is represented by line orange, 2020 blue line, and 2021 the gray line. So if you look here at the 2020, we see that in February, we started seeing a slow drop in surgery. We had 22% less surgeries performed than March, and the gigantic drop, minus 80% by April when lockdown started. Slowly going back up, May, 39% less surgery were performed, June, 3% less surgery, and by July, 6% less surgery compared with 2019. We have then a plateau, and they go up and dropped again. 2020 was more with some up and downs, but was a little bit better, but it still ended up the year with less 3% of surgeries comparing with 2019. Another way for us to see this, to look at this data, is looking the total number of surgeries by year. So 2019, I have it here in orange. I have the whole year. In 2020, I see that we had less 13% of surgeries, spay-neuter surgeries performed, so my blue bar. In 2021, we end up with less 3% surgery when we compare with 2019. We divide in categories, all this data, we divide by cats and dogs in different categories. So for us to be able to understand a little bit better. And we can see on this graphic that the percentage of surgery in cats and dogs didn't change among the years 2019, 2020, and 2021. And we can see in orange that we have the cats. We can see that we have almost double the size, the amount of surgeries performed in cats when we compare with dogs. And it was very similar between the year. When we separate the data from cats, here on the left side, the graphic on the left, and dogs, the graph here on the right side, we can see also that dogs suffer more, surgery in dogs suffer more with the decrease in surgery, spay-neuter surgery. So if we look at the dog chart, we have in 2020 less 19% of surgeries. In 2021, we still have less 14% of surgeries. Cats, 10% less surgery in 2020 when we compare with 2019. And we actually tried to recover. We got 3% more surgery here in the gray bar, 2021. We were able to push up a little bit, still in debit, but we saw a better recovery. And it does explain because all the efforts that we do for community cats, and also we know that cats have higher risk of euthanasia in shelters. Then we divide in males and females, and the percentage was similar. It's almost 50% males and 50% females for the 3 years. And the decrease in surgery was also similar. So if you look at the graphic here on the right, for males, we had a drop in 2020, blue bar, as 12% less surgeries, and for females, 14% less surgery. For 2021, for male here, the green bar, 1% less surgery, and for female, 4% less surgery when we compare with the orange, that is the 2019 graph. Bar, sorry. We divide them by age groups. So pediatric animals younger than 4 months old, adults between 4 months old and younger than 7-year-old, and the geriatric older than 7-year-old. Here we can see that the largest group that we perform surgery on are the adult groups, and we saw a decrease in 14% in 2020 and a similar number 2019 and 2021 when you look at when you compare both years. Pediatric surgery, 11% less surgery in 2020 and 8% less surgery in 2021. Of course, the geriatric group is this group that normally we perform less surgery on because these animals have less chance to reproduce. And also we saw the largest drop in surgery numbers for this age group, so 18% in 2020 and 16% in 2021, which also makes sense since this group needs more preoperative lab work. Sometimes you need to change the anesthetic protocols for them to be safe, and also recovery is lower for them. So it's understandable that we will hold these animals during a pandemic. We look also at unknown pets and known pets. Unknown pets, we include the community cats, we include municipal and public shelters, and also rescue groups. And we were able to see a slightly more drop in surgeries in 2020 and also 2021 for the unowned pets. So here we have 14% less compared with 2019. And if you look at owned pets, we have 12% less surgery and 1% less surgery in 2021. When you look at cats and dogs, again, we know that dogs, they suffer more with this drop in surgery. So own animals in our study in 2020 dropped to 18%, unknown animal 22%, and in 21 2021, we saw a drop for owned animals and 12% and 20% for the unowned animals. And it's interesting because we know what happened during COVID. The 2020, nobody really knew what was going on about transmission and between pets and people. So we tried to clear the shelter, and many dogs left the shelter without being spayed and neutered. Cats had a better recovery, as we saw before, and similar unowned and owned animals were pretty similar. So the last category that we have here is we divide by U.S. regions. The 4 U.S. regions, and we can see the first 3 bars. We have the South region, that we have the most number of surgeries are performed by the South region, and the drop was the last drop in spay-neuter surgery. So it had 11% less surgery performed in 2020 and less 2% in 2021. West and Northeast, they've had very similar numbers about the total number of surgeries, and also the drop in 2020 was 15% for both states. West region was able to recover a little bit faster in 2021, so we got 2% more surgery performed. Northeast is still suffering with minus 7% surgery performed. Midwest region was the region that we saw less surgeries being performed, and less surgery being performed, and also the biggest drop in surgeries. So 17% less in 2020 and 8% less in 2021. So now we have another question, and
yep. I will pull it right up.
Okay, and after that, while you are answering these questions, I will give the word to Dr. Levy, and she can complete this presentation.
So how is spay-neuter capacity in your community now? Great, we can schedule surgery slots for animals within a week. Surgery slots aren't usually available for at least a month. Surgery slots aren't available for about 3 months. Never enough capacity for spay-neuter in our community, even before the pandemic or COVID. All right, so we have 15% say great, we're able to book animals within a week. 33 says usually about within a month. 25% is slots aren't available for at least 3 months, and then still never enough capacity. So almost like a 50-50 split here for less than 30 days to over 30 days. So I'm going to hide those results. And then there's Dr. Levy. Excellent.
All right, so this was a very interesting look into the trends that we could see with the software that nationally collects real-time data on spay-neuter activity through Clinic HQ. And what we found at the beginning of the trend was that early in 2019, before the pandemic hit, clinics were on track to increase spay-neuter by over 3%. Over the previous year. So this is what we expect, is spay-neuter capacity has been increasing every year. But during the pandemic, during shutdown, not only were they closed, but also clinics lost staff and clinics lost income. And so some were actually completely temporary closed and had to furlough their staff. 4 clinics didn't make it out of the pandemic and had to permanently close. And 2 clinics gave up spay-neuter and just converted to wellness surgery. So we see it's not just the temporary impact on stopping some spay-neuter, but long-term threat to the spay-neuter industry. And overall, over the 2 years, 190,000 fewer surgeries were performed in the 212 clinics during this period than would have been predicted had they been on track for 2019 areas. So this is work that we have not come up with yet. So I look at this as interpretation of what all this means is that if a similar pattern occurred in all 3,000 spay-neuter clinics across the US, which I think our subset is a reasonable estimation of, there would be a predicted deficit of more than 2.7 million spay-neuter surgeries by the end of last year. So not only are we not back on track yet with the work every month that was being done, but we haven't made up for those surgeries that we missed. And this is very frightening for us who have been working in animal welfare for many decades, because it's been clear that the very high level of spay-neuter and improvements in access and driving down the cost and making it safer and doing pediatric surgery is really the single most important driver of reduced pet overpopulation and euthanasia that we've seen in shelters. So there's a threat to lose a lot of ground that we've made. And not to fearmonger even more, but I do have sort of a negativity bias in how I look at the world. And we know that pandemic conditions have not yet resolved, and many clinics have not yet returned to their baseline productivity. A lot of clinics are still doing curbside and other adjustments to be safe. The virus is still here. The Great Resignation has impacted the available workforce for veterinarians and for staff, and that is really threatening the recovery. And that these conditions come together to be ripe for an increase in unwanted litters and a reversal of the population gains that we've made over the past decade. And so in conclusion, I think we need to be very strategic and tactical in how we move forward. Veterinary and animal welfare organizations really have to take the available capacity that we have and focus on the populations that are most at risk for unintended reproduction or for poor welfare or for entering the animal shelter system. And in my mind, this would put TNR of community cats near the top. We know that they are the primary source of kitten litters, and that 50 to 75% of the kittens that are born will die before maturity. So it's a huge welfare threat. And fortunately, cats are the easiest to spay and neuter, so that is convenient. But then when we look at animals that come into shelters, one of the biggest issues for dogs are large breed dogs, because people often can't have housing with large breed dogs. So I think when we're looking at dogs, we should be focusing on the breeds and the size that are most likely to have poor outcome in shelters. And this would mean that maybe we should change our pricing and subsidies to make it cheaper to spay a large dog than to spay a small fluffy dog. I know the small fluffy dogs are easier and cost us less, but those dogs are not at risk in animal shelters. They'll be adopted quickly. So we should bring down the cost of females, and we should bring down the cost of larger dogs or breeds that are a problem in that region.
And one of the comments that we have out there right now on the questions was the fact that the vet shortage is a bigger issue than the pandemic. And so that's what's really cutting into capacity. It's not, these aren't necessarily numbers as a result just of the pandemic, but of more of the veterinary shortage. And so in 2019, when we were making predictions, did we just not even factor in this veterinary shortage issue? Or I thought we kind of had a sense we knew this was coming.
I do believe that some people knew this was coming. You know, AVMA still denies that there's a shortage, but I think veterinarians in the field in every level and corporate veterinary medicine is very, very worried about the vet shortage and trying to be creative about solving it through all of the ideas that Esther mentioned in the summary. And so I think the vet shortage has been coming for a very long time. The vet burnout rate and dissatisfaction with the profession has been coming for a long time. We talk about vets a lot because they're sampled, but vet techs, it's maybe even more severe. We don't talk about them as much as we should. And then the pandemic just made it all obvious. Like, just pull back the curtain and there is not enough people now. So even when we go back to efficient veterinary practices and you know, roll back curbside and other things that take longer, I think we're going to be left with not enough people to do the work.
Before we break for lunch, I have one more question here for Julie. Having done over 70,000 community cats in Gainesville, how does the unfixed cat population now compare to when you started?
Oh, it's a great question. I wish we knew the answer to that. We're looking to people like John Boone and team researching to tell us how we can actually count cats in the community, free roaming cats. We don't have the tools to do that here in Gainesville. It's a big deal to do it properly. So we use surrogate markers, like how many cats are going to the local animal shelter and what demand is for our surgery. And so our local animal shelter cat intake has plummeted over the years since we started this in 1998. But there's other factors to that too. We have other outlets and more rescue groups. But I do believe that we're also very focused on targeted response. So if there's a complaint or a high density of animals, we'll go TNR there. So we're TNR more cats that people care about. Either they don't like the cats or they do like the cats. But I can't say whether our community actually has less cats outside. We have less cats that people are worried about. We did a survey, about 12% of households feed cats that they don't own. We think there's about 30 to 40,000 free roaming cats in our community. So it's very large. But we euthanize only a few hundred cats a year now in our shelter compared to 8,000. So, and those are only cats that need euthanasia for humane reasons.
There is a question out there about sort of defining what's an essential service, going back into COVID and that whole long saga. And I will reach out to that person directly because we did a pop-up panel on that, and actually Neighborhood Cats did a whole flow chart, a legal flow chart in how to determine what was legal and illegal in your state at that particular point in time. So that's someone's asking, I've a question about how to keep track of your traps, and so I'll find that resource out.
Oh, I can just say, like, contact Operation Catnip and learn about Easy Rent Out. We have software and QR codes on all of our traps, and we scan them with a phone, and we no longer lose traps.
Awesome, great, thank you for that's Dr. Levy's best tips of the day.